Hello everyone, I'm Dr. Gaurav Kharya. I work as a Director Center for Bone Marrow Transplant and Cellular Therapy at Indraprastha Apollo Hospital, New Delhi. Bone marrow transplant, as you might have heard, is an established modality to treat various human diseases, especially various hematological diseases and also oncological diseases. So what is bone marrow transplant? Bone marrow transplant, as the name is suggestive, it is replacing the defective marrow of any particular person, any particular child by a healthy marrow. So whenever we talk about replacing a defective marrow with a healthy marrow, we need a donor. So when we talk about bone marrow transplant, it is of two types. One is called as the autologous bone marrow transplant, nowadays also called as high dose chemotherapy and autologous stem cell rescue. Another one is a allogenic transplant. Now, autologous transplant, which is used to treat various solid tumors, doesn't need a donor, and as the name is suggestive, it is just a way of giving high dose of chemotherapy, and then subsequently the stem cells are given as a rescue. When we talk about allogenic transplant, yes, definitely we need a donor. The donor can be HLA identical family donor, which is called as a sibling donor. If the sibling is HLA matched, then it can be HLA matched sibling donor, or in 5 to 10% of the cases, parents can also be a complete genetic match. So they are called as HLA identical related donor. Now, if some patient needs a transplant but unfortunately doesn't have a donor in the family, then we can look for a donor outside the family through various registries nationally and internationally, which is called as matched unrelated donor bone marrow transplant. Now, if unfortunately the patient doesn't have any HLA identical family donor or an unrelated donor, then we can look for a donor within the family which is partially matched, which is nowadays called as haploidentical family donor transplant. Depending on the disease and depending on the availability of the donor, we plan our strategy for bone marrow transplant. Over the years, the outcomes of bone marrow transplant have improved significantly, and nowadays we can almost very confidently say that if we do the transplant in the right possible way, choosing the right donor, the outcomes of any transplant, whether it's a HLA identical sibling donor transplant or an unrelated donor transplant or a haploidentical donor bone marrow transplant, the outcomes are more or less the same.